Hello everyone, welcome to the daily editorial analysis brought to you by Shankar IAS Academy, 17th March 2025. Displayed here are the list of articles that we will be discussing today. The first article, from insurance-driven private healthcare to equity. The article is taken from the newspaper The Hindu, which is talking about the challenges in the insurance-driven healthcare system, and we will also discuss what are the challenges in the Indian healthcare system. And in the second article, tackling the problem of nutrition, the article is talking about the current nutrition challenges in India, and also we will talk about the integration of this Saksham Anganwadi and the Portion 2.0 schemes. And this was announced in the Union Budget 2025. So without much delay, let's begin our discussion with the first article. Tackling the problem of nutrition. The article is taken from the newspaper The Hindu, which is talking about the present nutrition challenges of India and also talking about the integration of the Saksham Anganwadi and Portion 2.0. And we know that the 15th Finance Commission of India recommended the integration of the Saksham Anganwadi and Portion 2.0 programs. And the government of India gave approval for this integration, and finally it was announced in the Union Budget 2025. So let us discuss more about the article from the mains point of view. So first of all, we are going to see the nutrition in India. We know that nutrition, it is a process of breaking down of the foods into energy, right? And it is often shaped by factors like culture, caste, gender, and other factors of diversity. So for example, how the culture influences the health. For example, you can see that if you take the African continent, there are certain communities like Yoruba in the Nigeria or Zulu community in the South Africa. The anthropologists, they found that these communities have a huge lactose intolerance problem. And this is because traditionally they are not consuming milk or milk related products. And the next is caste. We know that the socio-economic background of different caste group often determines their accessibility to better health and better food, and that will ultimately reflects in their health and nutrition status as well. And the next is, if you take the gender, you can see the anemia case or the anemia problem is more in women comparing with the men. And if you take the transgender community, you can see their health issue is much more complicated and different from both the men and women. And in the case of India, we have a high problem of malnutrition, especially in women and children. We know that we have taken a lot of measures to address the health challenges faced by women and children. But you can still see that our rank in the global hunger index is 105 out of 127 nations. And you can see that the national policies are framed which gives importance to women and children, but there is also an issue. That is, the national policies are ignoring other target groups like men, the women over the age of reproduction, and also the elderly population in India. And this has to be addressed. That means the policies framing for better nutrition should be more inclusive. And these national policies are often ignoring other diseases like diabetes, hypertension, and other non-communicable diseases. We know that the 60% of the fatalities in India are recorded due to this non-communicable disease. And coming to the Saksham Anganwadi and the Portion Abhiyan 2.0, like I mentioned before, this was integrated this year and under the recommendation of the 15th Finance Commission. And both these programs are initiated by the Ministry of Women and Child Development, and this integrates both the nutrition programs of both children and women, which is focusing more on infrastructure development, providing hot cooked meals, and food fortification. That means we know that fortified rice. The fortified rice is an aggregate of many minerals and nutrients, right? And we can see that the Saksham Anganwadi, it was exclusively for the maternal health and child health, which uses both the digital facilities to track the health status of children as well as lactating mothers. And some of the key findings mentioned in the article. So these findings are taken from the National Family Health Survey 5. And that is showing that nearly 36% of the children under the age of 5 are stunted because they are not taller to their age. And the stunning is one of the indicators used by the officials to prepare this global hunger index. So coming to the comprehensive agenda, so we have to, like I mentioned in the beginning, we discussed what are the major challenges in India's nutrition, and what are the certain limitations in framing the national nutrition policy. Like I mentioned, the ignorance to women over the age of reproduction and elderly population. So we have to address all this, right? So for that, we need to expand the nutrition focus beyond the children and the maternal health. That means we have to include the elderly population. We have to address the health issues faced by the women over the age of reproduction, and also the problems of men, and a solution based on local food system. We know that, for example, you can see that the inclusion of the medicines through local food system can address the problem of health issues in different communities. And the next is linking local institutions with the health and well-being centers for implementation. So this will ensure that the programs are implemented to the grassroots level. We have certain initiatives like supplementary nutrition. That means providing take-home ration, providing iron and folic acid, and also the midday meal scheme. So this iron and folic acid is acid tablets. They are distributed through Anganwadis in the village and in the grassroots level, which is very essential for the maternal health. And we can say that recently India successfully reduced the maternal mortality to 100 per lakh. So we have to definitely we have to appreciate the initiatives taken in the grassroots level. And the next issue is also there, that is uneven health and well-being center distribution. That means we can see that 70% of the India's population is living in rural area, but only 40% of the health workers are working there. And on the other side, we can also see that if you take the health and well-being centers distribution, it is much higher in the rural area comparing with the urban area. And the next is the lack of systemic dietary guidance and dedicated staff to ensure the problem of nutrition challenge. And coming to the factors for the success, what can be done? The first is engagement of the local entities. That means using the influence of the local people, or using the gram panchayat or sabas to address the problem of nutrition challenges. It will help. And the next is linking the nutrition plans with local cuisines. This will help the communities to address the problem of nutrition challenge. And the next is, we have a success model, that is in China, when they were going through the smallpox vaccination drive in 1950s. You can see that they included the nutrition plans in their local cuisines, which ultimately recorded a very good result. And you can also see there is another example, that is a Brown University. They found a study that where the local elite people took the initiative for strengthening the vaccination. The vaccination was successful. So we can use the local religious leaders or local community leaders to promote the health of the people. So this will avoid health of the people. So this will encourage the people from the grassroots level to take medicines and address their nutrition problems through modern solutions. And coming to the conclusion, we have to see that primary healthcare is a key to better nutrition. That means it ensures the nutrition implementation of the nutrition programs to the grassroots level. And the next is, we have to understand that the health and well-being centers should focus on health as a well-being rather than not just an absence of disease. That means if a person is free from disease or any type of infection, doesn't mean that he is healthy. That means we have to focus on the well-being of the people as well, to ensure that all the people are healthy in the society. So in this topic, we discussed what are the major nutrition challenges faced by India, and how the Saksham Anganwadi and the Poshan Abhiyan scheme, how the integration will help India to address the problem of nutrition challenges. So with this, we will discuss a mains question. The question is, despite multiple government initiatives, malnutrition and poor nutrition remain significant challenges in India. Discuss the role of primary health system and local food system in addressing these issues. And this is a 10 marks question, and you have to write around 150 words. Write your answer, post it in the comment section. We will review and we will reply for your answer. With this, we will move to the next topic. From insurance-driven private healthcare to equity. The article is taken from the newspaper The Hindu, which is talking about India's needs to balance insurance schemes with strong public health investments for affordable health. We know that the inequalities are persisting in the society and in the economy in all aspects. Therefore, to make the healthcare more inclusive, we need both the insurance schemes as well as strong public investments in the health. And we know that the SDG Goal 3, which is talking about the health to everyone, that is ensuring healthy lives to everyone, at all time is very important. Therefore, maintaining this balance is also important to achieve the SDG goal number 3. So let us discuss more about this article from the mains point of view. So first we are going to see what are the problems associated with this insurance driven healthcare system. The first is a high out of pocket expenditure. That means even though there is a strong insurance policy, still we can see that 48% of the total health expense is still coming from the pocket of the people. And the next is limited coverage. We know that the government of India introduced this Ayushman Bharat Pradhan Mantri Jan Arogya Yojana in the year 2015, which provides universal health coverage to everyone. But still, large segment of the people in the society are still remaining uninsured, and there are also problems associated with claim rejection. We know that this will happen in both the government insurance schemes as well as the private insurance scheme. That means if the government, if the people are not insured in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, they might have made insurance in other private companies. The problem is that certain hospitals will not accept certain insurance companies. So this type, and that will result into claim rejections and other issues, and this will again leads to high out of pocket expenditure from the people. And the next is fragmented system. That means different companies have different policies, therefore the benefit will be inconsistent. And the next is rising premiums. We know that the insurance companies are driven by the motive of profit. So therefore, due to this changes in the economy, for example, due to the inflation and such factors, the private insurance companies will go for higher premiums, and this will only benefits the employers rather than employees. And the next is focusing on curative over preventive care. That means the insurance driven healthcare always focuses on curative model of healthcare rather than preventing the disease or the conditions. And what are the challenges in the India's healthcare system? First is the underfunded public health system. That means we are spending only 2.1% of our GDP for the healthcare, but you can see that this is much lower than the global average. That means according to the WHO, in the year 2021, the world spent around 10.3% of the global GDP for health. But you can see that India's even today also India is spending only 2.1% of the GDP for the public health. And the next is rural urban divide. And the next is urban rural divide. That means 70% of the people lives in the rural area, but only 40% of the healthcare professionals are working there. And the next is high disease burden. That means India is currently facing the problem of both infectious disease like tuberculosis, and on the other side non-communicable disease like cardiovascular issues, diabetes, hypertension, like that. And we can see that since 1991, since the period of LPG, the rising cases of non-communicable disease is getting higher, right? And also we can see that 60% of the fatalities are related to non-communicable diseases. And the next is expensive private healthcare. We know that the private hospitals are always costly, and the price, there is no fixed price. So for example, in one private hospital the price will be for example 10,000 per consultation or for treatments. On other side, large hospitals, they will ask for lakhs and sometimes even crores. So far we discussed what are the challenges in the insurance driven healthcare system, and then we discussed what are the major challenges in India's healthcare system. So what are the solutions can be given to address this problem? First one is increasing the public health spending. That means we have to spend at least 3% of the GDP for the public health. And the next is strengthening the primary health care. We know that the more PH. And the next is strengthening primary health care. That means introducing more primary health centers in the rural area, and making sure that more professionals are available there, and also digital health solutions. That means tracking the person's health. We know that the Saksham Anganwadi scheme, for example, the government introduced the Saksham Anganwadi scheme, and the Saksham Anganwadi scheme tracks the health of the women and the children digitally. The next is expanding the universal health coverage. That means including outpatients and diagnostics into consideration. And the next is boosting healthcare workforce. That means introducing more medical colleges, and making sure that more people are working in the rural area. So far we know that only 40% of the healthcare workers are working in rural area, but 70% of India's population is still in the rural area. So this type of disparities has to be addressed. And the next is promoting preventive healthcare. That means this is one of the major issues, like and the next is promoting preventive healthcare. That means going for immunization. We have the project Indradhanush. And the next is lifestyle awareness. That means we have Life Mission, which works for promoting the sustainable way of lifestyle for the people. And these type of initiatives are already taken by the government, but we need to strengthen it. And the next year we can also see that recently the government introduced a tertiary cancer, and we can also see that the increase in case of non-communicable disease is a burden. So therefore the government in this 2025 budget, they strengthened the tertiary care cancer facility scheme. That means it will under this scheme the government will provide fund for setting up state cancer research centers and the tertiary cancer research facility, care facility. So these type of initiatives have been taken recently, and this scheme is coming under the national program for the prevention and control of diabetes, stroke and cancer, and that is working under the National Health Mission, which was launched in the year 2005. So you have to note some of the recent initiatives taken for the health in the Union Budget 2025. You can use that for writing answer in the coming mains. And I hope you understood this topic, and with this we will discuss a mains question. The question is, critically analyze the role of insurance driven healthcare in India, suggest measures to strengthen public health investments. So critically analyze means what are the challenges associated with the insurance driven healthcare system in India. We discussed what are those challenges in the first slide, and the next is suggest measures to strengthen the public health investment. So try to answer the question, and it is a 10 marks question, and you have to write around 150 words. Try to answer it, post it in the comment section. We will review and we will reply for your answer. Now it's time to move to the next topic. With this, we are coming to the conclusion for today's editorial analysis. If you like the video, hit the like button, give your feedbacks as comments, and share this content with your friends. And before leaving this channel, don't forget to subscribe and also hit the bell icon to receive on-time update from Shankar IAS Academy. Thank you. Have a nice day. Thank you for listening to us. Thank you for listening to me. Thank you.